what I'm seeing is a big shift from experimentation to execution. And I think that this announcement kind of underlines that these large players who are, increasingly the incumbents, um, are betting on health. And so one thing that I think you'll see is a big shift from piloting chatbots to actually seeing co-pilots baked into workflows. So how this could change going forward is seeing more just specialized models going closer to the physicians and clinicians, um, helping helping those patients learn, but in a personalized way that preserves their privacy, things like that. And I'm excited to see, we used to talk about Dr. Google, and I don't think that goes away. There's still a lot of great information out there from, say, Mayo Clinic or things like that. Increasingly, we're seeing enterprise grade tools, and that means that they're HIPAA compliant, by default. That they accommodate things like role-based access, so people have just enough access and not not able to see things they're not supposed to. And auditing, the ability to kind of trace what led into a decision, things like that. The first thing, I'll give you a handful of kind of tips. The first thing I would say is don't panic. This is moving fast. Take a step back and evaluate where you are in this moment and the degree to which you're confident. If you feel frozen, HITLAB has resources for this. Kate, Center for AI Testing and Evidence, for example. You know, lean on your peers and so on, but just take a good, clear-eyed look at where you are. The functions and the outcomes that you can sort of hand off. Like I've done a talk on responsible cognitive offloading. That's a just to introduce that phrase. And then what are your strategic bets?